empowering the patient is at the forefront of a renal transplant ward. The impact that you have on parents and patients is amazing. And because it's a long-term life condition, you see the child grow from potentially a 3 to 4 year old all the way up to adult age. And that is a beautiful journey. Though you see some hurdles around the teenage years, you're still part of that patient's journey. And just to see them developing, for people like Will, who obviously been in that specialty for a long time and he knows the patients really well, it must feel really good to be part of their life, because it plays a massive part in their day-to-day.
Exactly. And then they always, like, when they walk past, they just put their head through the pharmacy dispensers. Hi, I'm here. Just to touch base with them, even though they're not come in for like medicine review or for clinics. It's quite nice to have a really good relationship building with the patients and parents. And you need that, especially for long-term people when potentially they've been on this mess for a very long time. And at some point, they may question themselves, I have to keep on taking these medicines. Can I just have one day miss? And then it can become non-compliant further down the road. So building a good relationship with them is actually quite nice to tap in and actually make a plan to say, okay, why don't we agree on some things that you can have some leeway to play around with the medicines. I'd rather have this open dialogue when they be honest with you and make a plan around the way of living, the lifestyles, rather than they just do it behind the back when don't know support at all.
I mean, there's a lot of conditions in paediatrics which are long-term. Look at sickle cell disease at the Evelina. You've got type 1 diabetics that get diagnosed on Mountain Ward. And patients come into hospital on a somewhat regular basis. You get really involved with the parents, you know about the siblings, you know what kind of things they have to juggle. And being a parent myself now, there's a whole new perspective when I work as a paediatric pharmacist. And it's really nice to see them transition in terms of the independence, starting off very much relying on the parent to do all the work, and then getting to the point where they transition to doing a lot of their medication adherence themselves, which is nice to be part of that journey.
Yeah, and you'll be amazed, a lot of children can actually say the medical terms really well. Like some people say, I have got JIA. Like, what is JIA? Juvenile idiopathic arthritis. That's a big word coming out from a 6-year-old or 5-year-old. Oh my God, and they can tell you not exactly the names. I kicked this one for that, and this one for that. I know what I did my MRI shows.
Whoa.
Hey.
Yeah, we've had a few of the renal transplant children, the 5-year-olds, who know you do a drug history, you don't need the parent.
Yeah.
They are just so educated on what they're doing, what the tablets look like, how often they take them, what they're used for, and they can pronounce all the names correctly, which is very cute.
Yes, exactly. So every time when I even talk to the parents, I actually introduce myself to the child first and then to the parents, and I always look at the child because they are the ones that actually like, oh, why are you not involved with me? It's my care. Some like feedback from the children just like, I want to be involved in my care. I want you to look into my eyes and ask me about my conditions, how I feel like, what our medications are for. So it's actually really nice to actually get them involved, because that's how it can transition the care to themselves, like looking after their own like medical health or their medicines, because they have been involved in day one of the journey.
Yeah, absolutely. And as a pharmacist in pediatrics, I think there's a lot of skill involved with kind of navigating the language that you use with children and what you might say to a 3-year-old versus a 6-year-old versus a 10-year-old, which is a really important skill, even if you're counseling on an inhaler or asking them how they feel when they have an asthma attack. What a 3-year-old might tell you in terms of detail is very vague compared to a 6 or a 9-year-old. And then it's quite interesting to see that development in terms of how they engage with you as well.